Good afternoon. Firstly, I'd like to thank you for inviting us to speak today. I'm not sure if people are aware, but that Macmillan has been involved with the survivor agenda for a number of years, and namely because we felt it was an area of the cancer journey that wasn't really highlighted, and Macmillan did a lot of work about gathering data together to actually create evidence that this was actually a part of the journey that needed to be looked at as part of the pathway. And I don't know if people remember, but I think that began with the 2 million and 4 million figures, which is mainly around adult cancer. But today I'll be looking at childhood cancer for you today. So, to start with, I just wanted to I suppose make you aware of some documents that Macmillan have put together over the past few years that has brought a lot of different pieces of information and evidence together. So this isn't just about research that Macmillan's done, but it's research that a lot of the different cancer and clinical charities have been involved in, and we've pulled it together. So we've got a number of rich picture documents on our website, and these both look at particular types of cancer, but also how cancer affects different age groups. So this particular publication was published last December, and we accompanied that with the information around the 10,000 number, which was around the number of children that are living with cancer in the UK now. And what we wanted to raise there was that although survivorship is not equal across all the different cancers that affect children, that there is an increasing number of children that are surviving childhood cancers, and we wanted that to be recognised. And that what we have done therefore is also extrapolate that data to look at what that may look like in the future alongside our adult data. So we've extrapolated that, and what we feel is that by 2021 the figures will be 40,000 children, and that's 0 to 14 that will be living with a cancer diagnosis, and that survival rate will be that they will survive 5 years since their diagnosis. So this slide just shows just the range of different survival rates for the 3 top cancers diagnosed in children between 2001 and 2005, and it's compared across the different age groups. So the top one is non-Hodgkin lymphoma, the second one acute lymphoblastic leukemia, and the final one on the bar chart is central nervous system tumours. And what we know that although there is variation, that we are looking at a higher survival rate, and this may be due to more aggressive treatments, but also higher resilience compared to some of the other older groups. Survival from central nervous system tumours, however, is an exception to the general rule, as survival is highest in teenagers and young adults, with children in the older group having a similar lower level of survival. As I said at the start of the presentation, we've got a number of these rich picture documents. So we've done 3 at the moment. There was one about older people, but we've got a children's one, but also the teenage and young adults with cancer. And the statistic there is based on data between 1991 and 2010. And some of the highlights from the report is that we know that 29% of 16 to 18-year-olds had to leave school altogether as a result of their cancer. But what we also know is that 5 out of 6 of those did complete their education. So although that they may have had to leave school and not been going to school on a regular basis, they were still able to complete their education. It shows that their determination to continue that. 5 out of 6 young people in this age group felt that their quality of life had been affected, and also high numbers of this group felt that they'd missed out on friendships made through work, school, college or university, and that also that their cancer diagnosis would affect their work prospects in the future. And although these statistics are small, they are significant in this group of young people. So again, just to show you the proportion of survival rates for 5 years again. 94% of teenagers and young adults diagnosed with Hodgkin lymphoma, one of the most common cancers you know, will live beyond 5 years after their diagnosis. And these teenagers and young adults tend to have a higher survival rate than those in the older group, the next age group, which is 25 to 49. And in particular, they have the highest survival rate for central nervous system tumours. And I think I would urge you to have a look at the documents on the website. We hope that they've been put in a really understandable form for people to look at the data and to make sense of it. And it looks at all across the pathway, so from diagnosis through treatment into the survival stage and then beyond. But it looks at not just the clinical pathway, but also the social aspects of the cancer diagnosis. And they're all available on our website. So where did survivorship start? Survivorship came out of the Cancer Reform Report, which was in the mid-2000s, and the National Cancer Survivorship Initiative began in 2010. It was a partnership between the Department of Health, NHS Improvement and Macmillan, and also other cancer charities, and predominantly Click Sargent was involved in that as well. And it must also be recognised that survivorship with children and young adults was well established before the adult programme came in. So there were lots of work already being done with child cancers and young people, young adults. And that had already involved lots of different groups, so all the charities that are represented today, ourselves, and a large number of clinicians and organisations were involved. And I think it's important just to look at the adult survivorship programme, because as more and more children and young people survive cancer, they will become adults, and they will, 50% of those will go on to receive some adult services in terms of support. So it's important that the two programmes link up. So what are the long-term needs of people affected by cancer at any age? So we know that there are a range of issues, physical and medical needs. Young people and their family often report they felt their concerns could be ignored during their cancer journey and that they weren't taken seriously. So these actually affected their relationships with their clinicians and could affect the outcomes of their illness. So in terms of financial needs, we know that in general, people affected by cancer have higher financial, spend more money than people without a cancer diagnosis, and that they're more likely to receive financial benefits. And I know that the parents in the room will know that, what those top three are, which is travel, car parking, and also extra food costs. And particularly for young adults, these debts may build up, so there are financial implications of having a cancer diagnosis. In terms of practical and information needs, there is a need, and it's really good to see the previous presentation around the information needs of children and young people, so that the information they're given is understandable and appropriate to them. And often the information falls between children's information and adult information, and that information needs to be appropriate for young people. Another issue is around isolation and loneliness, and often this is picked up on the adult pathway around the end of treatment. So when people feel that they've been abandoned, this has some similarity to young adults and children, but it's probably more around their social support and people involved outside of their clinical care that they might feel isolated from and need to actually make those relationships again. So these are the working principles that underpin the survivorship care. So having aftercare with a multidisciplinary team, Some of the key things that we've looked at are, not Macmillan, but the programme, is around having good needs and assessment care plans at the end of treatment and to all stages of transition. So children and young adults are clear about the treatment they've had and the consequences of that. They also have something at the end of the treatment that they can either pass on to their next team of clinicians, or that they can have in the future if any further complications happen. So this advocates for care coordination to streamline care and pre-planned and proactive transition arrangements at all stages of their care. And this is a key area that we know is yet to be addressed. So transitioning from children's and young people's services into adult care is something still to be looked at. In terms of what kind of aftercare needs to be provided, there are 4 different levels. So does the patient, the young person, still need a clinical-led follow-up? Can it be shared care? So can it be shared with a hospital team and a primary care team? Can it be delivered through nurse-led follow-up and supported self-management? And there needs to be interactive pathways for teenage and young adult patients and those with complex needs, so that all different needs are catered for. And a competency framework has been developed for nurses supporting children and young people after cancer. This is just the different pathways that have been developed, and it's just to note that there's a difference between the paediatric pathway and teenagers and young adults, and that's because there is more primary care involvement in the teenage and young adults pathway than the children's one. As part of the programme, the National Cancer Support Initiative, there are a number of different resources developed, and this is one to support professionals around implementing supported self-management. That is also of use to parents and young people themselves, really, because it gives a framework of what supported self-management is all about. And that's looking at how you support yourself to remain well, making sure you've got the information available, making sure you've got a key worker that you can go back to in the specialist team, that you can get access into your service, you get your specialist team again, and also a point of contact for the GP for that specialist team. This is on the website, so if you want to have a look at that, that's something that's very useful. Now, I have to apologise for the small font on the pathway, but it was just to give you an idea of the difference, how aftercare is stratified into the different levels, so that people can get the care that's most appropriate to them. And also just to point out how the survivorship has now been integrated into other guidelines to ensure that survivorship becomes a core element of services. Now, I must say at this point, from my point of view, survivorship has been very difficult to get embedded in adult services. So I can hope that although there will probably be challenging times within these pathways as well, that we can work towards getting that embedded. But the documents that actually support this are all there, so about making sure that it's part of peer review, so all the different elements of the survivorship plan is integrated into that. And again, just looking at that's the competencies we raised before, so making sure that staff have the support they need to actually deliver this care for their patients. So finally, I just wanted to point out some of the resources that are available directly for young people and their parents. Macmillan have developed a few, but there are many more that have been developed through Click Sargent, Teenage Cancer Trust, and they're all there to provide additional support for young people at the survivorship stage of the journey. I also wanted to I suppose plug the fact that Macmillan has got a service development arm, and that we are not as well known for developing services for children and young people as we are for developing support to adults. We do have paediatric CNSs at Birmingham Children's Hospital, and we're also beginning to develop other types of support for children and young adults. We have a number of support services in local schools. We also have some connected to hospices, but very much focused on life with cancer as well as end of life. And so I would just ask people to consider, when they're thinking of developing new services for young people in this area, that they consider talking to Macmillan about whether that support would come from us as well. We do have grants on our website that support groups that are for adults and young people, and also support for self-management programs. So if self-management programs are delivered by parents or looking at being developed, then we can support those as well. So although we're, I suppose, better known for our nursing staff and our clinical teams, that we are looking very much to support other areas, especially along the survivorship pathway. So this is just the adult survivorship manual that was released last year, and it has lots of different case studies around work that has been piloted across the country to support people across the survivorship part of the journey. And it's also just to, I suppose, make you aware of the recovery package, which is about supporting self-management, making sure that assessment and care planning is in place for everyone. So that's looking at a treatment summary during your active treatment, and then a care plan during your active treatment and treatment plan at the end of your treatment. And also looking at having appropriate information, financial and work support, as well as health and wellbeing events. So whether they be educational about aspects of support, or whether they're just about providing support to people at this point in the journey. So I've just put some contact points on the last slide there for you. So the first link is to our resources within our website. And if you have any further questions about survivorship after today, please contact us via the email address there. And again, just to remind that we have our helpline, which does have a section of helpline dedicated for young people from 18 to 25.